Hey, everybody. Welcome to On the Edge. I am Thorn, Krueger, your host, and I'm really excited, interested, intrigued, and actually inspired by the conversation that we're going to have today with Stephanie Campbell, who goes by, and I love this nickname, Sesame. So before we even get started, I want you to tell me how you got this nickname. And then also tell us a little bit about your background and what you're doing today.
Thank you, Rayanne, and what an honor and a privilege to be here to reconnect with you after our last conversation. I think 10 years ago,
Yes,
when
yes.
I was doing advocacy in other spaces. So the nickname, Sesame was given to me by my grandmother, who has passed, although she's still with me. And it's a name that my friends, certainly my friends in the recovery community, when I go into church basements and community centers and just friends that I meet, call me Sesame. Stephanie Campbell is my name that is on my birth certificate. It's my professional name. It's on my certificates, diplomas. But that's the story behind Sesame. And then in terms of just a little bit about myself, I've been doing advocacy work for many, many years. I've been first and foremost a person in sustained recovery from substance use, and also in recovery from mental health issues that are going to be a lifelong journey. But I was in 1989. I was a homeless street kid, addicted to uh, anything and everything under the sun that I can get in my body to take the fear away. And someone reached into the gutter, pulled me out, and gave me the message of hope. And I've been advocating for our community as part of my recovery. In 1989, I joined a little organization called ACT UP and started to work on HIV. AIDS and for substance use and for former sex workers and current sex workers, to get folks that were on the fringes of society, to humanize, organize, and mobilize so that we had better healthcare, better social determinants of health, dignity, and choice. And I've been doing that work for in different spaces. When you met me, I was working on the marriage equality campaign here in New York State, which we actually got the LGBTQ community, which is unfortunately currently, facing some,
Sure.
as women and other groups that, were able to get hard-won dignity. Some of that is attempting to be clawed back. So we will continue to fight for dignity and choice. But for the last 10 years since you've met me, I've been working on harm reduction and recovery, getting folks, access to life-saving medications, getting folks access to clean syringes, which is really a continuation of the work that we were doing back in the HIV campaign with ACT UP to stop the spread of HIV and AIDS. And so we're trying to get folks, trying to turn the tide on these horrific overdose death numbers that continue to go up, particularly here in New York State. I know you're in California, but we are really trying to stem the tide of overdose deaths. Last year, the CDC, and I believe that these numbers are underreported at 111,355 individuals perished from a preventable death, overdose death. And that's almost the equivalent of losing the entire population of the city of Albany, which is where I've been based in some of my government work. And here in New York State, almost 7,000 of those lives were lost here. So, we have a lot of work to do, and I've been really committed to here in New York State and across the country, working with advocates and government to find ways of restructuring our drug policy and get access to folks for life-saving medications and care to keep them alive.
It's such an important topic. I mean, I consider myself an average American, and I've known several individuals who have lost the battle to addiction. And I also cared for an elderly woman who was my first boss. I've always called her my bonus mom. She's living in a assisted living facility now, but when she came to live with me and I went back through her Medicare history, I discovered that she had OD'd 9 different times. Like, paramedics had come to her home 9 different times. 5 of the 9 times they had to use Narcan on her to revive her, and her healthcare professionals continued to provide her access to drugs that were destroying her. And so it's more far reaching than we can like the average American thinks. It is not
Mm.
just a homeless person living on the street. It is, which is tragic and horrible. But I think some people, and we're going to get to this, they have this discrimination in their mind about what an addict looks like and how access to substances happens. And it can be as simple as telling your doctor, if you're in your 80s, that I'm in pain all the time. And it nearly killed her several times and ruined her life. It really did ruin her life because it impacts other parts of your being eventually. So I want to get to the heart of it, which I find a really interesting topic is health discrimination. And I want you to describe what that is, what that means. It might mean something different to different people. I know that as I age, I have run into this already as I have aged.
Mm.
So let's talk about what health discrimination is.
Yeah, well, discrimination is, somewhat based on stigma, right? And stigma we define as negative public perceptions about individuals. That comes from, a host of misinformation and quite frankly, structural inequalities that are baked into our system, whether that's racial, systemic racism, structural inequalities that come from racism, gender inequalities that come from disparities for health among, individuals who identify as female versus individuals who identify as male. There's sexual orientation discrimination that's built in. There's gender identity that is based also and we know that the trans community is
Yep.
under assault. So those discriminations, but also economic discriminations. Based on access. A big issue that I was working on for the last 5 years when I was in government and. Was the issue of parity, right? And in terms of health plan discrimination, the kinds of, discriminations that are built into the healthcare system in which payers will pay for med surgical care, but not behavioral health care, right? And so there are, laws that, we advocated on, over 10 years ago to try to help address some of those discriminations. But depending on your zip code, depending on, your economic status, your race, your gender, your language, there's a whole host of um, areas in which people are discriminated against, particularly around healthcare. But some of the most glaring discriminations in terms of overarching macro discriminations for healthcare exist even in the way that healthcare is accessible to individuals. And then, we've been doing a lot of work on, addiction. And to your point about what does a person who's addicted look like? There's sort of a stereotype.
Sure.
Um, and so, changing some of those negative public perceptions and helping the public understand and normalize that addiction is like any other chronic condition. diabetes, hypertension, and we need to treat it as a public health issue, not as a criminal justice issue or a moral issue.
Right. That's the point that I wanted to get across, is that there is a moral discrimination attached to it. People just assume that if you are addicted to a substance, whether it's alcohol or a drug of some kind or behavior, like a sex addiction or something like that, that you must be amoral or that you must be a sinner, right? We
Mm.
attach sin to crime or to behavior that is different than our own. There and so I really want to understand why do you think understanding it is important? Why should we understand that this type of discrimination exists?
Well, we can't change something unless we name something, right? We can't get help if we don't ask for help. And we can't ask for help if we're told that the act of asking for help means that we are morally deficient, right? And it goes to shame. I often say that shame is at the core of addiction.
Yes.
Any addiction that you talk about across the board, whether it's you know substance use, whether it's food addiction, whether
Yes.
it's sex addiction, whether it's gambling, whether it's my latest addiction that I work on is workaholism, right? I can work
Yeah.
14 hours a day without taking a break. And, and meanwhile, my loved ones in my life are going, what about
Where
us?
are
Or,
you? Yeah.
where are you? Exactly. So, but really at the root of all addiction is shame, and it's isolation. It's a disease of isolation in which we get disconnected from ourselves and the world around us. And we're trying to address a sense of or a lack of self-worth, and we're trying to address loneliness. We call addiction a disease of despair, right? And so in trying to address that pain, every human being, and we're hardwired for this, our brains are hardwired for this. We're hardwired not to stay in pain. How do we get out of
Right.
pain?
Right.
Right. And so when we can see it from that perspective, that we all do it to some degree, I believe that we're all recovering from something, right? So if we can approach addiction and look at people who are addicted as individuals who need care and compassion, they need access to, oftentimes to resources. If we can get them connected to community and connection, and reduce some of that shame, they're not going to want to use in the ways that are potentially lethal.
It's so I mean, I become emotional about this because of my personal experiences. I was married to an alcoholic, and struggled through that. And he and I, well, we are no longer married. We share children together, and have come to a place in our relationship where there is so much forgiveness and letting go of judgment, shame, heartache that we caused each other, clearly. So that's a one facet. Then to see what happened to my bonus mom, and then for me and for my husband Lawrence, or my husband now, Lawrence, we have been on a path to try and understand this. And one thing that's really helped us has been watching shows, TV shows, series that allow you to look deeper into a person and maybe grow to care for them. I think some shows do a really good job at allowing the viewer to care about an individual that is an addict or that has a family that, I mean, and two shows that come to mind are The Wire and
Mhm.
Shameless, that show addiction, that show human beings that are living in squalor, that are just trying to get by, that have experienced health discrimination, that can't get health care. I mean, there's this stark difference between somebody that has health insurance and can go to the doctor of their choice and somebody who has to go to the clinic down the street that is infested, or isn't providing the best care. So I would admonish anybody who's watching that maybe doesn't understand this and still views it as sinful or immoral to dive a little deeper and open your mind and say, okay, I need to learn a little bit more about this topic so that I can gain perspective and also a little empathy about the situation. It's heartbreaking. It's heartbreaking, and we often just put up a shield of judgment and stop thinking about how we can support or how we can help someone because we judge them or say, well, they made their own nest, they made their own mess. They're going to have to clean it up themselves. But society and community often allows these things to continue. So understanding addiction and substance abuse and its impact on society and community is really important. And one of the reasons that I reached out to you for this conversation was the experience that you shared that happened to you recently on the train. And I would love for you to tell that story now because it hits to the heart of how we can support individuals that find themselves in a place where they feel like there is nothing for them and no one to help them.
Mm. Well, I will do that. I want to just something that you just said, and there's so much that you said, and I think we need to continue this conversation. So this is a first
Yeah.
in what I hope will be
I
several
agree.
conversations. Um, you talked about the way in which there's a humanization that's happening in the media, in public, you know, in pop culture expressions, right? And I think in part because so many people have been impacted, right? When
Yes.
you think about the number of people who have been impacted by COVID, right? And all of the, all of the money and the attention and we didn't blame people for getting COVID, even people who didn't get vaccinated. We didn't say
Right.
to them,
Or
"You're not
masks.
going to get
You know,
care," or a mask, correct, right?
right.
These are people that were deserving of care. And I think what we're grappling with as a society, and we still have, a way to go, but the war on drugs dehumanized people. And you mentioned The Wire, which is one of the most amazing TV shows ever created.
On
I've
many
seen it
levels. On many
on
levels.
so many levels, so many levels. But the way in which that the different layers of community, the different groups, the union guy, the
Yeah.
union guys, the guys who are slinging in the projects, you know uh, um, law enforcement, all of
Right.
that sort of,
All of those things. Yeah.
and the different layers that each of these communities have been impacted by addiction, by mental health, and the PTSD that's associated with the trauma that the war on drugs and the prohibition of even accessing care for many communities has
Right.
brought about, right? The devastation to the communities, the collateral consequences on the children, and the intergenerational trauma that gets passed on. I mean, we could have a whole series,
Yeah.
a whole conversation on that. But in terms of trying to understand these these disparities now, and how we can really focus our attention, we have to be able to normalize people who are experiencing addiction. And what's scary right now, Rana, and I hope your viewers can hear what I'm about to say, that that COVID blew the top off of people's pain, right? There were there, the isolation that we experienced, the global trauma that we experienced,
Yeah.
and the long tail that impact, that the impact had on mental health and the way in which people, started using what we call naive drug users, people who had never used certain, illicit drugs, started turning to try to get some relief. And then the impact that that has had on the workforce, the people who are providing those services. During COVID, we had parades and we were celebrating nurses and how can we
Right.
support the workforce. But people in the field, the professionals that are trying to care for people who are addicted and have mental health care, there are no ticker tape parades for them. And they have been shouldering and carrying the pain that COVID and the economic impact that it's had, the social impact that it's had, the stress in families that it's had, and the way in which people are devastated and trying to get access to treatment. And at the very time that people need treatment, we have less of a workforce because they haven't been supported, and many of them are burnt
Right.
out, and they're not getting paid on par with doctors and nurses and all of that. So there's huge disparities across the board, that we have to address in order to get people the help that they need.
Before we go to the train story, I want to talk about what you shared, and my personal experience has been with mental health care that and mental wellness is that there is such a stigma attached to it. We don't want to talk about it. We hide it. We pretend that we're fine. And much of this was exacerbated by COVID, like you shared, by the isolation, by the unwillingness to be vulnerable about what we were experiencing. And I kind of have likened it to if somebody has cancer, there is visible awareness of that struggle, right? They're either exhausted and in bed, they've lost their hair, they've lost weight, and we never apply shame to that struggle.
No, we bring them casserole dishes. The
Right,
community rallies around them and
right.
says, "How can we support
And
you?"
we have ribbons for them, and
Right, that's
you
right.
know, we do
That's
we
right.
do walks for them, or we wear a
That's right.
specific color. The MLB wears pink all in October,
That's right.
whatever it is, whatever it is,
Yeah.
that mental wellness, mental health awareness has to
Mhm.
come to that same place that we're trying to get to with
Yeah,
addiction recovery, and that is
absolutely.
we have to remove the shame. And I think, to reference back to the shows that we're talking about, when you add a human being to that conversation, when you learn things about, and since you brought up The Wire, after I did, the character Bubbles that we came
Oh,
to, Bubs, the homeless man on the street that we came to care for so much and
yeah,
watched his struggle for
yeah,
what was it, 8 seasons, whatever it was, 7 seasons, watched
yeah.
his struggle and watched him turn the corner and then fall back again and then come back and then fall back again. And then
Mhm,
how he started to heal was
mhm.
actually helping others,
That's
right?
right.
When he
That's right.
got in the trenches and started
Mhm.
serving at a homeless kitchen or whatever it
Yeah.
was. And I will definitely,
Big
this will be
service.
an ongoing viewing for me because of the awareness that it brought to me
Mhm.
and the opportunity it brought for me to care about somebody that if I'd seen them on the street, I would have walked past or judged.
Yeah.
And
Well, it's why I do the work that I do. It that
I I
built into my recovery is service. And so to your question about the guy on the train. So,
yes,
you know, it was a God wink, right? It was a God moment. We often refer to in the recovery community as there are no coincidences. It's just God's way of remaining anonymous, right? These coincidences.
yeah.
And so I'm on the train, I'm heading down to a gala. I'm heading to a fancy gala. I've got a black dress, and I'm very nice. I look very, very polished. And I'm on the train and this guy, I get on. I'm looking for a seat, and there's this guy, and there's an open seat, and other seats are taken, and this guy looks a little, something's not, your average Joe here, but I'm like, he said he made space for me, and I sat down, and we started talking. This happens to me all the time. I cannot, people who know me, I get on planes, I want to sleep, and I end up having a conversation. Anyway, so I so we start talking, and he looks me up and down, and where are you from? And I said, Stephentown. He says, where's that? And I said, it's on the border of Massachusetts. And he said, what do you do? And I said, well, I work on drug policy issues and overdose prevention nationally. And he sort of, he says, and I'm not going to say what he said because we got to clean up our language here but he says, oh bleep, I just got out of. He said, I used to use drugs. I just got out of, doing time in Utica.
Wow.
And I said, welcome home, brother. And we ended up having a recovery, we had a recovery meeting. He had been going to meetings, oftentimes folks in recovery, and I've done this, I brought meetings into the jail behind the wall. And he stopped using drugs for 8 years. But drugs is what got him into prison, and he'd done a number of bids. So he's, in his late 40s. He's been in prison and jail since he was a juvenile, right?
Wow.
He grew up in a family that was addicted, right? So we're sharing all of this, and we're connecting, and I'm sharing my story, and he's sharing his, and he said to me, I'm not going to lie to you. He said, I haven't been with a woman in 8 years. He said, I'm not going to the shelter. I'm gonna get a hotel room, and he said, and I've been thinking about doing cocaine. I haven't done cocaine in 8 years since I've been in there.
Oh.
And I said, brother, please just hear me. I said, the drugs are different now than they were when you went in 8 years ago. Anything that's got powder has got fentanyl in it. And
Yeah.
your body is not used to not having fentanyl. And you are most vulnerable right now. The folks that are coming out of incarceration are the folks that are dying, at extremely rapid rates because they don't have the infrastructure. Their bodies, they
Yeah.
don't have the infrastructure of being able to get naloxone. They don't have the infrastructure of folks connected. Many of them have been disconnected from their communities and their families. They're alone. They tend to, die alone, and their bodies don't have the tolerance. He said, yeah, I heard we heard, that stuff is bad with the drugs now. I said, please. I said, listen, would you be open to my connecting you with somebody who's in recovery, who got out of prison like you, and who's working now with folks that are just getting out of prison, and that person can connect you with some resources so that you don't have to be alone, and get you, surrounded with support, and so that you don't have to be alone and look to old ways trying to cope, but there's a new way to live. And he said, yeah. And so I gave him the number of a friend of mine, and I talk about this friend of mine all the time, who, uh, beautiful human being, works with people who are coming out of prisons and their families. Um, and So I connected the two of them, and now he's working with Chris and a group of guys who are in recovery, who are formerly incarcerated. And that's the piece that we're really trying to sort of get folks access to. Not everybody will go to treatment, right? Not everybody needs treatment.
Right.
But the thing that changed my life, and the thing that changed, so many people across, the country. There's 23.5 million of us living life in recovery that you don't hear about, right? But we're having these amazing lives because somebody looked into our eyes and said, you don't have to live this way. And spoke to us with compassion and shared their lived or living experience of recovery or reducing the harm that was happening in their lives. And we built that community and connection. And community and connection, compassion, dignity, those are the values that save lives. You can mandate all you want. You can tell people just say no, or shame people, but that's not going to get them to stop using,
No.
and that's not going to save their lives. What's going to save their lives is it's the therapeutic value we say in recovery of one alcoholic, one addict helping another. That's without parallel. And I'll tell you something, during COVID, during the lockdown, I was working 20 hours a day, 7 days a week. I had people calling me all hours of the day and night because they couldn't get their loved ones into treatment. And I
Yeah.
was running a statewide agency to try to office to try to get folks access to care. It was the peers, it was the people with lived experience, it was the folks in recovery who were going to homeless encampments. They were showing up at people's doors with a cup of coffee, with compassion, and saying, how can I support you today? Not, did you use drugs today? Not, here's some naloxone so that you can stay safe. Here's my number. If you need to use, don't use alone, right? That kind of love and support, that's what's saving people's lives. And we need the clinical, expertise as well. Like it takes a village, I often say, but we've got to start with that love and that connection and that care, and that, and you've got a whole army of people in recovery, of peers, of folks with lived experience, engaged in harm reduction, who, for them, part of their journey of recovery, a major part of that is being of service, is helping others, because that's where they get a sense of meaning and purpose. And it's certainly where I get mine.
It's incredible what we can learn when we decide to be curious and let go of what we deem as right, good, and moral, wherever our judgment level lies, whether it's, on the legal, or if it's religion, or wherever we place our judgment and the reason for it. When you let that go and you can look at individuals as human beings who are just trying to get by like everybody else, then a whole new level of understanding and care, and the opportunity to help somebody feel like they belong in this world, in this place, in this community, wherever they feel like they belong. And we individuals, whether we have experienced it ourselves or it's been part of our family, or we can provide some level of care or support in just not judging,
Yeah.
by a smile, by how can I help you, by slipping somebody a $5 bill, whatever, shaking their hand, asking if they need a ride, whatever. It can be very simple and easy, or it can be a lifelong commitment like you have devoted yourself to. And I can't thank you enough for what you have done. I've watched you over the years. I've watched your career progress. And part of that is because of the level of care that you have sought to provide for others as part of your own recovery. And it's been wonderful. And I'm in no place to be proud of you, but I'm so proud of you and what you've achieved and the work that you're doing. And I can't thank you enough for being here today. We are over time already. So this tells me there is so much more for us to talk about. And before we get away today, I would love for you to share how people can get in touch with you. And if it's as simple as messaging you on LinkedIn, great. But if there's an email address or anything that you'd like to share now, we will also put it in the comments of the section below this broadcast. So how can people get in touch with you?
Well, I will give you my email address, which I think you have,
Yes,
but
I
I'll
do.
give it to you. You do, okay. And folks can always call me, and my number is area code 518-788-3018. I share my number with when I ran, the statewide
Yeah.
office of the ombudsman. People had it, and folks can have it. So feel free to call or email me.
Sesame, thank you so much for being here today. I hope that I can get you back on the show and we can talk a little bit more about this. There were a couple of more things we wanted to talk about. And I think we covered some very important parts of this issue as an introductory. I don't think by any means that we covered it as much as we can. So I hope you will come back and continue to have this conversation with me. And I hope individuals that are watching know that they can add questions or comments in the comment section, either on this is streaming on LinkedIn and on Facebook. I'm going to make these interviews that I've done over the last year and a half, with some of them with my partner Bennett, available on YouTube also. So they'll be more shareable. for folks that aren't actually on social media like Facebook or LinkedIn. It's such a pleasure to speak with you and keep up with the really good, amazing work. Thank you. Thank you so much, Sesame.
Thank you.
We hope folks will join us again next week. I'm hoping to talk into the topic that I touched briefly on today, which is providing care for older adults. We're seeing more and more families that are pulling aging parents in and the issues that they're facing, whether it's getting health care for them or if they're battling with addiction, like I did with my bonus mom. She didn't even believe or think she was addicted, but she had doctors that were not really providing the best care for her. They were just giving her something to shut her up and make her go away, and it ruined her life. So I hope you'll tune in for that next episode. Thanks again, Stephanie. We'll see everybody soon.